Yeah, let me introduce you.
Okay.
For those of you who have not heard Dr. Doyle present before, he is a retired staff anesthesiologist in the Department of General Anesthesiology at Cleveland Clinic, as well as a retired professor of anesthesiology at the Cleveland Clinic Lerner College of Medicine of Case Western Reserve University. He first joined Mensa in 1972. He received his MD in 1982 and his PhD in biomedical engineering in 1986, both from the University of Toronto. In 2017, he received a Doctor of Philosophy degree from the University of Pretoria in the field of moral philosophy. He has had a lifelong interest in neuroscience behind consciousness, and his most recent book, and you might have had a more recent book since this was a few years ago. The one I have is on the topic of transhumanism, which was published by Springer. And then Dr. Doyle has received teaching awards on 4 occasions, and he does have a website if anybody's interested. And he also presented numerous times at the Mensa AGs. He didn't present this year, but at least the last 2 years he's presented. And standing room only, I can attest to that, because I have to stand in the hall to hear him. So now I'll turn it over to you. This is your new presentation for you.
Okay, thank you very much. And I'll go to share mode here to make sure that you can see everything.
Yep.
And does that look good?
Yeah.
Okay, so medical AI examples, opportunities, and cautionary tales. If you want a copy of these slides, just write to me at djdoyle@hotmail.com. Glad to send them to you. As I said, I'm an anesthesiologist, and here I'm assisting anesthesia resident in putting in a breathing tube intubation. My rough credentials: past president of the Society for Airway Management and Society for Technology and Anesthesia. What do anesthesiologists do? Well, you need an undergraduate degree. I did physics in my case, 4 years of medical school, 4 years of residency, and then now it's customary if you want to go into academia to do fellowship training. We, of course, manipulate consciousness for a living and also work on blocking pain, caring for ICU patients, and perioperative care. As you can see, I'm also an author. My interests are clinical airway management, computers in anesthesia and in medicine in general, and the book on the right we already had mentioned to. My engineering qualifications and computer qualifications are here. And one of my first efforts in introducing automation and artificial intelligence and algorithms in medicine was this 1988 collection of programs for medicine. And it did a variety of simple calculations, as well as arterial blood gas analysis in this particular later version, which came out 40 years ago. So this was even before the IBM PC was a platform. This was for the Radio Shack PC2 and Sharp 1500 little computer. And here it is right here, so small that it uses computer tapes because this is before flash drives were invented, before CD-ROMs were invented, even before floppies were invented. But we were able to write programs. Here's an example of a software analysis I was able to carry out for a physiological research project. And here's all the various programs that were included in this first package that I wrote some 40 years ago. So let's take a look at medical AI and explore the realm. And because medicine is so vast, the medical applications of AI are vast as well. I'm going to talk about early warning systems, chest X-ray interpretation, and many other things, as well as cover some basic concepts. What is AI, and what are the types of AI, and how does rule-based AI work in medicine? So AI has rapidly changed the way we live and work. Remarkable progress in medicine. I'll show you some examples. And there's many branches to AI. Machine learning will get exposure to, networks as well. Robotics will cover only very briefly. Expert systems and fuzzy logic will cover only very briefly. Here's another artist's rendering of how this might be done. Speech to text and text to speech, very important. Image recognition, particularly for X-rays. Predictive analytics to see how patients are expected to do, for example, when sepsis sets in. So these are all examples of applications. Beneath AI or included in it is machine learning, and deep to that is deep learning. The idea with deep learning is that it's a subset of machine learning, which the artificial neural networks adapt and learn from vast amounts of data, as opposed to mere machine learning, where the ability to learn is carried out without being explicitly programmed, but it can't program itself necessarily. So these are some of the concepts that you'll deal with, and there are many applications of AI, as you can imagine here, from robotic personal assistants, thought-controlled gaming, which with the Neuralink, natural language processing, pattern recognition, and so on. So there's many, many different fields, and people who work in one field may know nothing about the other field because everything's so specialized. Self-driving cars are one of the realities that we deal with and is affecting the way society works. There'll be self-driving boats, there will be self-driving trucks, and this will change the landscape in important ways. Surgical robots, as shown here, this is the Da Vinci system. They are advanced micro-manipulators, but they don't really do the surgery themselves. You have a human operator. That is until now. Now it turns out that there is a technology in evolution, not yet used on humans, a technology in evolution where you record an operation done many, many times, like a cholecystectomy done once and then twice and then hundreds of times, and you record the whole video at all, and then you put it to AI and you program the surgical robot to carry out the same kind of activities that were carried out for the original cholecystectomy. So being done on cadaveric animals, not done on humans yet, but you can imagine this is something that is going to evolve over time. This is taking place at Johns Hopkins. Now, for those of you looking for everyday things, here's the Apple Watch, and it has many medical applications. Simplest one here is the medical ID, so that a person can get information on you if you collapse. You can get medications being alarmed for you so that it can tell you when it's time to take particular medications. For the elderly or the infirmed, if a heart fall is detected, an alert appears and allows you to signal that you need help or that you're okay. Heart rate notifications. Here it says the heart rate rose above 120 beats per minute while you seem to be inactive for 10 minutes starting at 9:59 a.m. What's going on here? Well, it turns out that some people who have had the COVID vaccine get a mild myocarditis, and it shows up with a tachycardia around 120, even though you're inactive. So it will tell you that. And in fact, this happened to my own son, who called me up and said, here's what happened. And I don't have an explanation for it, except that I had the COVID vaccination and a little bit of work. It's associated with mild myocarditis in some cases. Atrial fibrillation, it can detect atrial fibrillation as well as bradycardia and tachycardia. So this is the ECG app, and in a clinical study, it demonstrated 99.3 specificity in classifying sinus rhythm, 98.5 in classifying AFib for the classifiable results. Here you can have a blood sugar sensor on your arm or elsewhere, and it will transmit the data to your Apple Watch. So this can be very useful for for type 1 and type 2 diabetics. So key to all this is the concept of knowledge representation. Without knowledge representation, there is no AI. The goal of knowledge representation is developing a model for encoding information about the world. And there are many, many forms available: symbolic logic, semantic networks, ontologies, probabilistic networks that you may get in the Bayesian model, and so on. So we can't possibly go through all of these other than to explain they exist. But here's an example of a form of knowledge representation that is a simple rule-based thing. It's an if-then-else statement. A first-degree heart block is present if the PR interval exceeds 200 milliseconds. So you measure the interval. If it's 220, you have a first-degree heart block. If it's 180, you do not have a first-degree heart block. It's as simple as that. So there are rule-based systems that I just gave you as an example. Another way of knowledge representation is an ontology, the hierarchical structure that relates concepts relationships and rules to organize information. I'll show you some examples of that in the context of a semantic network, type of knowledge representation that use nodes to represent concepts and edges to represent the relationships between these concepts. This is another form of knowledge representation. And if you have probabilities representing various kinds of states, then you can use Bayesian networks to solve certain kinds of conditional probability things. It turns out, though, that the challenge in many cases is knowing what the probabilities are between the nodes, as that information may not be available. So medical AI applications, medical imaging, diagnosis, clinical treatment, decision support, prediction of disease progression, and so on. And you can imagine there's a variety of startups trying to transform healthcare in some way based on AI. So we'll see how all that plays out. Some of them will do very well, some less. And of course, it'd be really nice to know which ones to invest in and which ones to avoid. So artificial intelligence and machine learning have the potential to positively impact healthcare, both in clinical diagnosis as well as patient monitoring. I'll show you an example of that. Coming up with treatment plans, enable physicians to take preventive measures to improve patient outcomes, identify new drugs and treatment for diseases, providing personalized health recommendations, tracking patient progress, and perhaps even reducing healthcare costs by streaming processes and reducing medical errors. There is a dark side to reducing healthcare costs using AI, and I'll bring that to your attention in a few minutes. So let's go on to the man behind all of this, Alan Turing, who in 1950 wrote a famous article. He begins, I propose to consider the question, can machines think? So this is a philosophical journal called Mind, and he offered a new form of a problem that can be described in terms of a game we call the imitation game. How well can a machine imitate a person? So you got a machine on the right and person B on the right, and person A is communicating with them. And if they can't tell the difference between the machine and person B, then perhaps that's a form of thinking. So the imitation game. And here is the famous beginning to this particular question, which endures to this day. He also developed a concept called the Turing machine, mathematical model of computational abstraction, which is capable of implementing any computer algorithm. So people want to study computer science at the theoretical level, they'll understand the Turing machine. For those of you who want more information, I recommend this movie, The Imitation Game. And here's a comment from the internet. What a brilliant movie. Very first time the movie, very interesting, story based on real events is fabulous. So I would recommend it. So has the Turing test been passed? Well, if you talk with ChatGPT for long, the answer is yes. Although here they say the Turing test has long been a benchmark for machine intelligence, but what it really measures is deception. You're deceived because you think it's a real person, or at least a genuine intelligence, and it's an artificial intelligence that's simply rearranging words in a very clever way. Now, go back to 1965, we have one of the first efforts of AI carried out with this interactive computer program called ELIZA, which is a mock Rogerian psychotherapist. So Rogerian psychotherapists basically take what you say and put it back to you. And it turns out not to be as useful as some of the other approaches to psychotherapy that are now in existence. But it confused people for a while that some people would think that it was genuinely intelligent when it was just rearranging your words. But since that time, from 1965, we have AIs that are genuinely indistinguishable from a genuine psychotherapist. And one of the issues that has come up is, what is AI-assisted psychotherapy entitled to do, and what regulation should surround it? Now, another landmark is Watson, a natural language question answering computer invented by IBM. It defeated two former Jeopardy champions, Ken Jennings and Brad Rutter, in a televised game. And this is another example of AI beating the smartest of humans in a very focused kind of question. Now we have ChatGPT launched November 2022. So we're talking about 3 years coming up next month. and immediately started a new age of AI. So let's take a look at it. Remember that all knowledge depends on some form of knowledge representation for AI. And we've got rules, maps, flowcharts, algorithms, frames, scripts. All these are various ways of representing knowledge. For medical applications, for example, in the software I showed you earlier, a lot of this is just rules and flowcharts. The rule-based AI, here's an example of 3 rules. The first-degree heart block I've mentioned. A patient is obese if their BMI is 30 or above. A patient is diabetic if their hemoglobin A1C is 6.5 or above. Now, that doesn't mean that these rules do not change over time, or that there may be exceptions to these rules. For example, it turns out that in the case of the obesity to BMI over 30, people are saying, well, you know, what's really going to be useful is skin fold measurements. And so it may become more elaborate in the future, but these are all rules which are in the clinical lexicon right now. Here are semantic networks where we can see that a cat has fur, a bear has fur, a cat is a mammal, a whale is a mammal, a whale is in water, and it shows the various kinds of representations that can be useful. These are semantic networks, ways of representing knowledge. And here is what ChatGPT says about it. It says, a semantic network is a form of knowledge representation that organizes information in graph-like structures whose concept represented as nodes and relationships between these concepts represented as links. So it's a pretty good example here. Let's take a look at medical AI and a rule-based approach that's more sophisticated than the ones I gave you earlier. Let's take a look at clinical early warning systems. The idea is that you're in the intensive care unit or in a step-down unit or even on a regular nursing floor, and you'd like to know when things are going south. So here are the things you can measure easily: pulse, temperature, systolic blood pressure, respiratory rate, consciousness level, oxygen saturation, any supplemental oxygen. So some of these can be measured automatically, pulse and temperature. Consciousness level, you kind of have to interact with the patient to do that. But here is an example of some of the parameters that are monitored in a clinical early warning system. So this is the first one from the National Health Service early warning system. And it takes a look at all of these parameters and it assigns a number. So for example, if the pulse is under 40, and that's definitely something you want to work on, you get a 3 in the score. And the systolic blood pressure under 90, you add 3 more to that. And the respiratory under 8, you add 3 more to that. And once the score goes above a certain amount, an alarm is sounded. So here is this in more detail, showing you respiratory rate, consciousness level, oxygen saturation, and the use of supplemental oxygen. This can all be charted in a manner like this, so that nurses at the nursing station can go and recognize when someone is potentially a problem. And then if the early warning score is at the first level, it sends out a message, often by pager. If it's at the highest level, it may call an emergency code where people will scramble to the bedside. And we have medical response teams whose job it is to respond to exactly that kind of situation. It doesn't necessarily have to be something issued by request at the nursing station. It can happen automatically in some scenarios, depending on how it's programmed. So we have many approaches to medical AI, as I show here. Rule-based approaches among the most common in the old days. And I mentioned how this is carried out. Here's an example of an expert system rule pertaining to microbiology. If the gram stain is gram positive and the morphology is coccus and the conformation is chains, then the organism is possibly streptococcus. Now, what's interesting is that it's a rule that simply assigns a probability to it. And it even gives it not a number, it just says that it could be. And that's useful in a way, but it's not as definitive as you would like in some of the settings. And it shows you some of the challenges in getting AI to deal with ambiguity. It could possibly be something else as well. So rule-based approaches to medical AI have an if, then else type statement. And this is something we all see from computer science. So here's an example of some code from, in this case, the C programming language for the Arduino platform. And it shows you how if and else statements are included in the code. Here is the modified early warning system. This is another version of the early warning system. And it says, if your score is between 1 and 2, Perform 2 hourly observations, inform the nurse in charge. So check every 2 hours. If your score is 3, perform observations every 1 to 2 hours and inform the nurse in charge. If it's deteriorating, then the duty officer must attend. If your score is 4 or more, observations at least every half hour. To ensure medical advice is sought, contact the outreach team. So this can be done automatically if needed. It can even send out pagers to the patients, to the patient's doctor. Doctors still use pagers, and I can say, since I've used them one as recently as 2 months ago, they can be very helpful aside from using a cell phone. Okay, so here is exactly that same thing, if then else statement for encoding rules in if then else's. Another approach is to use a map of some sort. Here's the Forrester heart failure classification, which plots cardiac index versus pulmonary capillary wedge pressure. This one is a flow measurement on the vertical axis, and on the horizontal axis, it's a pressure measurement. And it divides into 4 subsets. And depending on which subset you're in, it defines what the therapy is. For example, subset 1, just keep an eye on things. Subset 4, the patient is cold and wet, and you probably want to give a diuretic to reduce their blood volume. Another map-based approach is for arterial blood gas analysis, where we take blood from an artery, typically the radial artery in the wrist, and we plot the arterial hydrogen ion concentration versus the bicarbonate concentration, and it divides it into these following regions, which all have clinical significance. So it's just a matter of plotting one against the other. And you can represent it as a series of acid-base diagnoses using a flowchart, as shown here. So this is just pH, PCO2, and bicarb. And is an example here, including enough intelligence that it knows when you have possible laboratory errors. So here's some of the diagnoses that show up. And that can be very useful in treatment. So if the pH is less than 7.35, PCO2 45, and bicarb under 22, then it's combined acidosis, and so on. Okay, now another approach that is available is called Bayesian networks, where you have a variety of states, X1, X2, X3, and so on. And then you have probability of transformation or transfer from one state to another. An example here is, suppose we want to develop a diagnostic system to tell if a person has the flu or not. We can represent this problem using a Bayesian network. Flu is the variable representing whether the person has the flu. It's a target variable. You want to predict this. Fever is whether the patient has a fever. Cough is whether they have a cough. And then you need all this data, like the probability, the posterior probability of a person having the flu, the probability of the fever given the flu, of the fever given no flu, probability of a cough given the flu, probability of a cough given no flu. And then all of this goes into Bayes' theorem, and you can crunch out some results. So the probability of flu given fever and cough is the probability of the fever and cough given flu times the probability of flu divided by the probability of fever given cough. And here we have concepts like joint probability that is all well and good, except for the problem that we often don't know the actual numbers to go by. Like here, we've got 0.05, 0.9, 0.1. But in some cases, particularly for some kinds of cancers, they are collecting the data to develop that kind of information over time. An example is a network used for breast cancer diagnosis. The network includes age of the patient, family history, results of the mammogram, presence or absence of a lump, and results of a biopsy. And then the relationship between all of these is known because of many, many patients, and they're able to come up with measurements. So rule-based AI versus machine learning, which is the best for medical AI? I'm going to introduce you to machine learning in more detail, and this can be supervised learning or unsupervised learning, and I'll give some examples of the difference. And then there's deep learning, where the algorithms adjust themselves, and this is perhaps among the most exciting of things. So here we compare supervised learning with unsupervised learning, two basic approaches. The difference is supervised learning uses labeled data to predict outcomes. Unsupervised learning does not. So here's supervised learning. You send a whole series of pictures of apples, and you tell them these are all apples, and you develop a model, and based on the model, it predicts that it's an apple. So step one, you get all these images of cats, put them into the machine. Step 2, feed new unlabeled machines to see if it tags properly, and it divides them into cats or no cats based on that training, and we see how well they do. It's good for classification as well as for regression applications. In unsupervised learning, you don't know in advance what's what, and you just look for clustering. So if you get input data, you can see that bananas are different in their longitude to width ratios compared to an apple, and so on. So in unsupervised learning, you get all these things mixed together, and you're trying to develop similarities between the cats on the top and the dogs on the bottom. And this can be useful for clustering, identify similarities, as well as identifying anomalies in networks. For example, is a hacker intruding on our network because this behavior is atypical and warrants review. In the case of anesthesia, for example, we want to use this kind of training to determine whether the patient is awake or asleep. And we'll take a look like the electroencephalographic pattern, the entropy in the EEG, the mean arterial pressure, and heart rate variability. These are all examples of things that could be used to decide whether the patient is awake or asleep. One of the challenges here is that you can have degrees of asleep and degrees of awake, and you have to rely on clinical judgment in the end, in my opinion. So ChatGPT, it's been around for almost 3 years now. It's used for predictive modeling, real-time monitoring. So these are all applications of AI, prediction of postoperative pain, assistance with difficult airway management, decision support, automation of routine tasks. So here are some of the AI applications in anesthesia. And here's the selection that ChatGPT offered me, and it's basically correct. So I gave ChatGPT some questions. Please explain the precautions that anesthesiologists must take to reduce the risk of gastric aspiration following induction of general anesthesia in the patient with incomplete gastric emptying. So in anesthesia, we want you to have an empty stomach before you put to sleep, because there's a concern that stuff in the stomach may go retrograde up your esophagus and into your mouth, oropharynx, and into your airway, and then you get big time trouble. It's like pouring stomach acid into the lungs, definitely a bad thing. So we take precautions, and here is the answer it gives. And I'm not going to go over this except to indicate that it says some things that are just wrong. Patients should be left in the left lateral decubitus position. Not really, we don't do that. And on top of that, there are techniques called rapid sequence induction, cricoid pressure, awake intubation that are commonly used in this particular setting. ChatGPT makes no mention of it, no mention. Now, maybe if ChatGPT focused entirely on reputable sources, that might be useful. But it consults every imaginable source, including some sources like Reddit, which is not exactly peer-reviewed. Okay, so that's a problem. Please discuss potential indications and contraindications pertaining to awake fiber optic intubation in the patient with a suspected difficult airway. So if the patient is going to be difficult to put the breathing tube in, for example, because they don't open their mouth well, and so we're going to go in with a television camera at the end of a scope, fiber optic intubation, what are special indications? And it gives me this lengthy response. And for the most part, it's pretty good. It's pretty good. There's nothing that's highlighted. And this is the kind of response I would expect to get from a person on their oral exam. So good. Third question, please explain the considerations, precautions they must take in dealing with a parturient, a woman is going to deliver in need of an emergency cesarean section for profound fetal bradycardia. So the heart rate of the fetus is slowing down because it's not getting enough oxygen. You need to do a cesarean section right away. And there are special precautions for that. This is a standard board question that every anesthesiologist will be asked at one point in their training. And here's an example of the AI response, and it's pretty detailed, so that's good, except it says some things that are not really true. Rapid sequence induction, in some cases, rapid sequence induction may be necessary to provide rapid airway control and ensure that the patient is deeply anesthetized for the procedure. It says in some cases, But in fact, that would be our standard approach. It's not just in some cases, it's almost all cases. And they say anesthetic techniques that allow rapid awakening and early extubation, such as regional anesthesia. With regional anesthesia, you don't go to sleep. So there's no concern about rapid awakening and early extubation. So these are an example of some of the misunderstandings we're getting from ChatGPT. Now, I asked ChatGPT make a multiple choice examination question set, and they did a not bad job. Sample choice questions on tracheal intubation, potential complications. So I would advise that if you're using ChatGPT to come up with an exam, review it yourself to make sure that it makes a lot of sense. I said, please give me an outline for a lecture on artificial intelligence in medicine with emphasis on anesthesia, surgery, and ICU. Came up with this outline here, introduction to artificial intelligence in medicine, drug discovery, and so on. So it can be very useful in brainstorming. And that's one of the useful things, I think, is ask it to brainstorm ideas. So let's get back to medical AI. One of the articles I bring to your attention, Artificial Intelligence, the new Alexander Fleming, which we wrote 2 years ago, 2021, it's been a while now, showing that AI can be useful for infectious disease management. And in fact, AI is aiming to tackle drug-resistant pathogens by coming up with new molecules. And it's coming up with new molecules based on its understanding of the structure of bacterial cell walls, for example. But it's necessary to come up with these new molecules. In some cases, the organic chemists are saying, this is a great molecule, but we have no idea how to synthesize it. And so that's another AI problem, how to synthesize new molecules. So here's a platform called the Ampli platform, connects the digital biological biome to high volume peptides and proteins extraction. So this is an example of machine learning in this case. And radiology, there's been a particularly useful series of developments as an extra pair of eyes for radiologists. Here, this particular chest X-ray interpretation can identify 20 plus chest lesions from conventional X-ray scans, lung nodules, fractures, pneumothoraces, collapsed lung, pleural effusions, and so on. So here is an example of one of these systems, and it's identified 3 fractures. We can zoom in on them and see these fractures. So that's pretty cool. And then it can also read CT scans for different kinds of cancer, looking for example, lung nodules. And so here it's detected a lung nodule. And the next thing that likely will be needed is to try and get a sample of that lung nodule by bronchoscopy. Here you can detect 4 different conditions from a single chest scan. And you could get this going with stroke detection via CT scans. If you have a patient who comes into the hospital and you're wondering about a stroke, you have limited time before you're able to fix it, and you get a quick stroke detection via CT scan, that would be great. It turns out that there are now ambulances with CT scanners built in them, so you can get your CT scan on the way to the hospital so that you have minimized the amount of time taken to fix that scan endoscopically. Chinese hospitals deploy AI to help diagnose COVID-19. Here, an AI pacemaker software package saves lives by identifying devices in seconds. It looks at the X-ray and tells you what kind of device it is. Now, it turns out that these devices, when interrogated by this master controller that's outside the body, it will tell you who it is and how much energy is left and all that kind of stuff. So for the most part, all of these pacemakers have associated systems which will tell you their model number, serial number, and so on. So this device software can identify over 1,600 different types. What about artificial intelligence in anesthesia? Well, as far back as 1983, people have been working on this problem. This guy here, Perry Miller, he tried to use this kind of augmented decision network, and here as the semantic network to try to represent how anesthesia is carried out. It's more complicated than that today because this is 1983, but the concepts are there, even though many of the drugs that he mentioned, like galamine, are no longer available For that matter, pancuronium is not available, enflurane is not available, halothane only available in some of the worlds, some developing worlds, and so on. But it shows you the idea. Now we're working towards closed loop anesthesia, where it automatically monitor your brain activity and other parameters and adjust the amount of propofol that you're getting so that you have a constant depth of anesthesia. Another thing that people are working on is a robot that will automatically put the breathing tube in automatically using 2 television cameras and AI assistants. In the intensive care unit, there's a lot of work been going on for a while. This is the Journal of Clinical Monitoring, 1988. Same Perry Miller that we introduced here also is the co-author on this article here. And you can see that there's a variety of articles that have been published, review articles in particular on artificial intelligence and anesthesia. I'll give you 2 examples where they can be useful. One of them is sepsis, where you want to know if the patient is becoming sepsis, the leading cause of morbidity and mortality, and it achieved high predictive accuracy in this case of the sepsis model. Here, antibiotics can be chosen based on AI advice. Ventilation can be carried out automatically with systematic AI for ventilation. And here's an article showing how they carried out this study. Medical diagnosis, they collaborated on the use of AI in the domains of diagnostic radiology. I mentioned dermatology, pathology, ophthalmology, so many different categories, as well as a prognosis for things like sepsis. Now, I mentioned the problem of what is consciousness? Machines have it. It is at the moment an unresolvable philosophical problem known as the other mind's problem. And although it's interesting, it's beyond the scope of this discussion. The problem is mental states are privileged and cannot be directly shared. Consequently, one cannot be philosophically certain that other beings are actually sentient as opposed to just behaving that way. You don't have access to my brain. Now, that may change if we do implanted electrodes. And what's particularly interesting is a case of conjoint twins who share brains, of which there's been 2 in the whole recorded medical literature. And from what I understand, sometimes one is able to know what the other is thinking because they share brain tissue. Future AI platforms are going to develop, suggest lower cost medications that may be just as effective as some more expensive medications, offer insulin administration strategies to recommend to diabetes, and so on. So these are things we're going to see in the future. I gave ChatGPT a test case. I said, my patient has a new onset of chest pain, which she describes as sharp and worse during inspiration. Any ideas about a diagnosis and some helpful tests? So this is commonly called pleuritic pain. And it came up with an answer. It could be pneumonia, yeah. Could be a pulmonary embolism, yeah. Could be pleurisy, yeah. And then it goes on to make some recommendations about how to approach it. All of these are very reasonable. And you could even, I guess, do a workup and suggest it to your family doctor if you want, but they may be a bit nonplussed by it. And some of these things you may not necessarily want to do all at once. Computed tomography angiogram you'd want to do after blood tests, for example. Here I asked, what are considerations for parturient undergoing emergency section under fetal aortocardia, and I mentioned that as well. Here, ChatGPT, on a separate question, issued an apology. I play with microcontrollers and medical instrumentation. And I said, what Arduino microcontroller has the pin layout and spacing of the Arduino Uno, but it's much more powerful? Because I was looking for an upgrade. And it goes on about the Arduino Doyle. And it says it's pin layout and similar, and it operates at 84 megahertz and all that. But it turns out it was wrong. It was really wrong. It says, I apologize for the mistake in my previous answer. There isn't an Arduino microcontroller, the exact same pinout layout as you can, but it's much more powerful. So it screwed that up. So is medical AI trustworthy? Only problem is it tends to hallucinate its own facts. What do we do? Run for president. Below it says Trump told over 30,000 lies while in office. Well, here's an example of an anatomical illustration showing how the trachea And here is the trachea. This normally sits above or anterior to the esophagus right here. So this is something we all learn in introductory anatomy. Discuss the position of the esophagus relative to the position of the trachea for cricoid pressure effectiveness. And it says, in general, the esophagus lies posterior, the trachea is separated from it by the vertebral column. Whoa. The esophagus lies posterior to the trachea, separated by the vertical column. Look at the diagram. That's not the case at all. It's completely wrong. Wrong. So ChatGPT is like a genius friend. Super glad to help you. Happy to answer any question. From summarizing Plato's allegory of the cave to helping you write out your computer program for your Arduino, ChatGPT is there, assist you instantly and at no cost, although I go for the $20 a month model. Astonishingly intellectual, wonderfully polite, nothing I can't comment on, but there's a problem. Sometimes he remembers things wrong. Sometimes he provides the incorrect information, kind of like an honor student taking an oral exam who just misses getting an A in his assigned exam grade because while he did a pretty good job, there were some apparent misunderstandings. So here's an example of another one with gastric pull-up surgery. So can we trust computerized ECG interpretation, the electrocardiogram? Here's an article here where they do a case presentation showing that ECG was interpreted as atrial fibrillation at a rate of 35 beats per minute. And it's not that case at all. It's just completely wrong. As you can see, we have to have some sort of human confirmation. And if you want more information on that, misinterpretation by computerized ECG machine, case report literature review is present. So there's challenges. These include lack of standardization, need for large volumes of data. And here's another challenge. You probably saw this guy before. Remember, we talk about the dark side. When a medical insurance CEO was shot dead, people celebrated his death. What does this tell us about American healthcare? Well, it turned out the murdered insurance CEO had deployed an AI to automatically deny benefits for sick people. So that's the dark side to AI. Here's another dark side, a case of misdiagnosis carried out July this year. So the NHS, the National Healthcare System in the UK, trials AI-driven diagnostic tools to streamline patient care. A London-based patient received an AI-generated false medical record, invited for unnecessary screening diabetes. It was generated by a software package called Annie AI, and it said that he had diabetes, but he had attended the hospital for a case of tonsillitis. And instead, it said he had presented with chest pain, shortness of breath, and attributed to likely angina due to coronary artery disease. And in reality, he had none of these findings. These are all hallucinations. AI produced false positives. There's no human oversight to catch the error. And faulty records led to direct patient contact, telling him to come in and do additional testing. So these are some of the consequences. Algorithmic shortcomings, no validation, lack of clinical review. So AI's risk must be addressed along with its benefits, with a need for human oversight, validation, and error mitigation. Some suggestions are shown here, feedback for retraining, regular audits, and this is carrying out in many developments, as you can imagine. Lessons learned, AI in medicine needs safety nets, transparency, and human oversight are needed. Early detection prevents harm. AI is not infallible. Design your balance automation with oversight. Is it a danger to humanity? This is another theme that we don't have time to go for in detail, but facial recognition, something going on all the time in China, speaker identification, warfare robots, surveillance drones, and the management of social credit. These are all things related to AI and facial recognition that are debates. And so I asked ChatGPT about the risks to humanity. It came up with a variety of suggestions, all of which I think are excellent. Is using ChatGPT a form of plagiarism? And ChatGPT said, well, you should indicate your sources. I agree. But this is something that's very important in medicine now that we use ChatGPT for brainstorming purposes and beyond. So in conclusion, while AI has the potential to transform medicine, it remains important to address the challenges. One final note, our focus must be solve clinical problems, not merely how to throw technology at patients. And that brings us to an end. Thank you very much.
No, thank you.